A prednisone dose this high is almost sure to cause side effects. I'm Dr. Megan, the Prednisone Pharmacist, and I'm here to talk to you about how to cope with prednisone side effects. I'm going to share tips about different things that affect side effects, different aspects of medicine that affect side effects. Affect side effects. And then I'll give you a special gift at the end. So the first one I already alluded to, and that's the dose. You can see this one is 20 milligrams. 20 milligrams of prednisone is a lot. Prednisone is mimicking a hormone in our body called cortisol. And cortisol is normally between 2.5 and 5 milligrams equivalent of prednisone. So when we're taking 20 milligrams, it's really likely that we will have side effects because that's way more than what our body normally makes. So the first principle of side effects to understand is that the higher the dose for prednisone, the more likely to have side effects, and that the side effects change as the dose goes up. Lower doses can have different side effects, but generally the principle is if you lower the dose of prednisone, you lower the side effects. The next principle is timing. Timing can affect lots of different medicines. So, for example, when you take prednisone, it usually says on the bottle, take in the morning with food. And that makes sense for most people to take it in the morning because our bodies secrete cortisol in the morning. Mostly. It's the highest in the morning and it decreases throughout the day. So that by bedtime, it's almost gone. That leads to a direct side effect if it hasn't worn off. One of the top side effects, in fact, the number one tweeted complaint of people on prednisone is insomnia. And so if you take the prednisone first thing in the morning, then you're more likely to be able to fall asleep at night and hopefully get better sleep. Other medicines, like for example, prenatal pills. Millions of women are taking those to make sure that their children don't get birth defects. And one of the side effects of prenatal pills is nausea. And so if you take a prenatal pill at bedtime, that can decrease the nausea because you're sleeping through that. And it gives that, there's ingredients in there that actually can help with nausea. So they can kick in to help with the morning sickness. But back to prednisone and timing. There's actually some evidence showing that for certain conditions, it might make sense to take it at bedtime. I know that's totally a surprise because it makes no sense with the body's natural release of the cortisol, but what it shows is that it helps with the purpose of taking the prednisone. For people who have rheumatoid arthritis or other inflammatory joint conditions, it could be more helpful to take prednisone at bedtime because then it's at the peak dose when they need the pain relief. Because most people with rheumatoid arthritis and other inflammatory conditions like that have the highest amount of inflammation first thing in the morning. So if the medicine is kicking in right when they need it, then that's perfect. Instead of waking up in pain, taking the medicine, and then waiting half an hour to an hour or longer for it to kick in. So you could explore that with your doctor. All right, the next topic is body rhythms and thyroid hormone. Thyroid hormone is the number one drug prescribed in America. And so people need to understand how to take it. It should be taken first thing in the morning, right when you wake up, and hopefully on an empty stomach with just a glass of water. 30 minutes before you eat anything else. And that is because your thyroid would normally release the thyroid hormone in the morning. And it would help you with your metabolism and your energy and your temperature regulation, all of these important things. And so it should be taken first thing in the morning. But it shouldn't be taken with a lot of things. Like, for example, here's the next one. Calcium and other drug interactions. So it's important while you're on prednisone to be taking calcium with it. But you shouldn't take calcium with thyroid. But a lot of people who are on prednisone have a thyroid problem. So if that's your situation, then you should take thyroid hormone first thing 30 minutes before you ever take anything with calcium in it, like a glass of milk or other foods that have calcium in them. And so you don't want to take a supplemental calcium with it either. At least 30 minutes, if not 2 hours. And then you could take your calcium supplement You could take the prednisone with the thyroid first thing in the morning. Those don't interact. Those are fine together, but you wouldn't want to be taking the calcium with the thyroid hormone. The next principle is absorption. So what affects absorption? People commonly need to take iron supplements. They might have anemia or other things causing low iron. And iron is best absorbed when taken with something acidic, like orange juice or Coke or coffee. And so if you have to take iron, it's best to take it with a swig of orange juice or something else acidic. That will help it be absorbed. Then with prednisone, should it be taken with or without food? That is the question. I was taught in pharmacy school that you should always take prednisone with food because it'll help with stomach upset. And if there's anything that I've been surprised about while taking prednisone myself and learning and studying as much about it and following Facebook support groups for people on prednisone, is that almost no one complains about stomach upset. I never hear it, ever. That's never anybody's concern. So if you are having stomach upset from the prednisone and not from something else, please let me know because you're the first person I would know about. Therefore, I wanted to share with you that there's actually not the best evidence that taking prednisone with food will get rid of the problem that it's hoping to. The idea is that it will prevent a peptic ulcer. But they found that most people who get a peptic ulcer are getting it because they're taking prednisone with another medicine called an NSAID, like ibuprofen, meloxicam, naproxen, any of those pain relievers that you can usually buy over the counter, except for a few of them. So basically what I'm trying to say is you can take prednisone with food if that helps you to feel better while you're taking it. But you don't need to kill yourself over it if you don't want to take it with food. I personally took my prednisone with a tall glass of water and a few nuts. Finally, I wanted to give you some tips about how to navigate side effects. First of all, you should never face side effects alone. You should keep your healthcare team informed of what you're experiencing. You should definitely tell your doctor's office and your pharmacist. Did you know that your pharmacist has a doctoral degree? That means they've been to so much schooling to understand the new medicines on the market today. We've learned as pharmacists how to help you cope with these side effects. So another thing a lot of people don't know about is your pharmacist is required by law to offer to give you tips. But most people refuse that offer. They just sign a thing saying, no, I don't want to talk to the pharmacist. So take your pharmacist up on it. Ask them, what tips do you have to help me with my side effects? What tips do you have to help me feel better while on this medicine? You might be surprised at how much your pharmacist knows and can help you. Finally, I promised at the end a gift, and that is the prednisone checklist. On the prednisone checklist, I've included the top 7 mistakes people on prednisone make, and then 15 ways to cope with that, with the top side effects. I created it because I took prednisone myself and I was miserable, and I did tons of research to find the best ways to cope. And I've compiled it all for you in the prednisone checklist. Check out the link below. Signing off as Dr. Megan, the Prednisone Pharmacist.